The purpose of this video is to provide you with the important information about the best surgical treatment for your condition. The reason to consider a lumbar decompression type of surgery is generally to relieve back and leg pain, particularly pain that's made worse with walking or standing. Lumbar stenosis is the diagnosis that most commonly requires this type of surgery, and stenosis essentially means a narrowing of the spinal canal, and the spinal canal is the space in your spine where the spinal cord and the nerve roots live. Essentially it's along the back of the vertebral bodies, behind the disc spaces, and that space can become narrowed because of arthritic changes in the spine. Typically, as patients become older, these arthritic changes, including bulging disc, as the disc become less healthy, some of the ligaments can become thickened, bone spurs can form, and some patients will develop what's called a synovial cyst, which is an outpouching from the joint. And any or all of these structures can be present in the same patient and contribute to stenosis, which again means a narrowing of that space. The spinal canal again contains the nerve roots, and the nerve roots have a certain size and they need a certain amount of room, and if they don't have that room and they're compressed, then that can lead to symptoms. So essentially this type of surgery involves removing whatever structures are causing the narrowing. Again, it could be a synovial cyst, it could be a bone spur, it could be a thickened ligament, it could be even some disc material, or a combination of any of those structures. This does carry some risk. There's two types of risk really. One is the risk of anesthesia, which has to do with your medical comorbidities, things like high blood pressure or diabetes, age, other medical conditions, and it may be that you would need to have an anesthesia clearance in order to have surgery. Typically, an incision is made posteriorly on the lower back at the level where the stenosis is, most commonly the L4-5 level or the L5-S1 level, although it can be in the thoracic spine, in the upper portion of the torso, or any lumbar level can be affected by this. But we make as small an incision as possible. Sometimes it's a single level, sometimes it's multiple levels, sometimes it's on both sides, sometimes it's only on one side. So again, the amount of exposure and the size of the incision is determined by the severity and extent of the stenosis problems. In any case, once the level is exposed, meaning that the muscle is dissected off the bone, some bone is removed, usually the ligament, and again, if there's a synovial cyst, it's also removed. Those can sometimes be adherent or stuck to the dura, which is the covering around the nerve roots, and have to be carefully sort of peeled off of the dura in order to relieve the pressure. And essentially, once that is accomplished, then that problem should not recur. There are also specific risks of the surgery itself. These would include things such as an infection, which is a very unlikely complication, less than 1%. Dural tear, also a very low percentage, less than 1%. It's possible that even with successful surgery, you may have some persistent back pain long term, and in some cases late instability also can occur because of the removal of some of the bone and ligament in order to create the space for the nerve root. Immediately following surgery, you'll be returned to the outpatient surgery area Typically you will have some incisional pain, although it's usually well controlled. You should be able to ambulate, you should be able to drink, you will need to be able to walk out in the hall, empty your bladder and so forth. And assuming all of those things occur, you will be able to go home usually that same day, although as mentioned previously, it's possible you could stay, but that's pretty unusual. For patients who are having pain, particularly with standing or walking, especially if you've responded well to blocks in the past, you can expect good relief of that pain, again, particularly the back, hip, and leg pain with walking. And that's really the main benefit for most patients, is they can stand longer, they can walk further. It's important to realize that this surgery does not fix the arthritis. I would love to have a way to fix the arthritis, but I don't. And no one else does either, unfortunately. Most of the time, these type surgeries can be done on an outpatient basis, meaning that you come in, you have surgery, you go home the same day. In order to go home, you have to be able to do certain things. You have to be able to walk out in the hall, you have to be able to drink, you have to be able to empty your bladder, you have to have adequate pain control, all of these things. Most patients are able to go home within a few hours of the surgery, but if you have problems or cannot meet those criteria, then potentially you may spend the night. So certainly you need to be prepared for that, although that may not be the initial plan. With regard to what to expect after surgery, usually for the first week or two, your back will be fairly sore. Again, that depends to some extent on the number of levels, and is it one level or two levels, or is it one side or both sides, and things like that. But certainly for the first several days, and probably for the first week or two, your back will be fairly sore. You should be able to get up and walk by yourself. You should not need any help with that. You will be taking some pain medicine, you will be taking some muscle relaxers, usually for a week or 10 days, something like that. Typically, I like to see people back in the office around 2 weeks after surgery. At that point, usually like to get patients into some outpatient therapy to work on core strengthening, to progress their walking, and start progressing their overall activities. Developing a long-term program of core strengthening and taking care of your back will be very important, because, as I mentioned earlier, the arthritic condition that caused the stenosis in the first place is still present. It has not been corrected, and so managing that going forward really comes down more to how you treat your back and take care of your back, and again, the exercise program is really key. Certainly the long-term expectation following this type of surgery is to have significant pain relief in both your leg and back, and be able to return to normal activities. Typically there are no restrictions or limitations necessary, and patients usually are able to return to full function.